Hey, She-Slayers, and welcome to another episode of She Slays the Day podcast. I am your host, Dr. Lauryn Brunslick, and today we are talking fertility. I have a non-chiro on. I have a fertility coach, Elizabeth King. She's from California. She's awesome. You're going to like her. She's great. Okay, hold on. She is awesome. So this isn't about her. But I had a patient this morning. And she's one of those, I'm going to sound like a pessimist here, but she's one of those people that everything is always amazing. Like, how was she had to present to a business group, and I'm like, how'd the talk go? It was amazing. It was so empowering. And I'm like, oh, snap. Okay. No, maybe it was. But like, she's also somebody that can be like, how was your poop this morning? She's like, amazing. It was the best poop in the world. And I was like, huh. And so, okay, I get it that there are some people that are just way more optimistic and happier than I am. And I'm not saying she's in the wrong. That's not what this is about. I think we could all be a little bit more like that patient who is just views the world through just joy and optimism. But let's be honest here. I'm not a pessimist, but I am quite cynical. So what I struggle with is like, if I tell you something went awesome, I mean, it went awesome. If I tell you like, I've given better podcast episodes, that's what I mean. And so how do you trust optimistic people? That's basically what I'm asking. How do we trust them? You cynics and pessimists will know what I'm talking about. But equally on the other end of the spectrum is we all have that patient who is always so negative. So again, I would take 100 really, really optimistic people over 100 really negative people. I think both would kill me. I think I just need realists in my life. So yeah, you just can't trust anything they say because it's like, well, was it terrible, Susan? Like your Christmas was terrible. Was it terrible? Or do you just think everything is terrible? Like, we fixed your migraines, but now you're mad that your elbow hurts. Like, what can I trust? So I don't know. You can't really respond if you agree or not. That's the funny part of this podcast scenario. But yeah, it was just one of those things. The reason I got on this tangent is because I said she was an awesome guest. And I worry that, I say that about every guest. And then you guys are like, Lauryn, can we trust you? Can we trust you? You can trust me. Here's what I'll say. I think we just do a good job of vetting out people who might not be awesome guests. So by the time they get to the microphone with me, they're going to be good. They're going to be good. Okay, let's do a listener highlight. So this one is actually from a CA. So her Instagram is Britt Raybinder. Britt Raybinder. Maybe her middle name's Ray. Maybe her first name's Britt Ray. It's a weird first name if that's your first name, Britt Ray. Sorry if I just insulted you. And she is a CA, but she's going to chiropractic school, and she might have started. I don't know. We have a long chat history. But her highlight, or her listener supporting highlight, is, your podcast has given me so much more insight into the possibilities of chiropractic, and I love hearing from your perspective as a somewhat local mom, female chiro with a banging business. Thank you very much, Britt Ray. I hope that chiropractic school, she's got a lot, she's got kids, and she's looking at juggling, going to school, and that's intense. I remember looking at the students who had like lives that they needed to attend to when they left school. And I was like, whoa, that would be hard. When do you study? And I don't know, they figure it out. It is funny though, how you can make any stage of life really stressful. All right. Like if you run your own business and you've got kids, you look at your friends who run their own business but don't have kids, and you're like, what do you do with all your time? I think back to like college, and I'm like, legit, what did I do when I was only taking like 18 credits in undergrad and I'd have like class from 1 to 4 on Monday? Like, did I just sleep? But somehow I found it to still be stressful. Yeah. It is like, man, this is quite the tangent, but like it is something where I look at teenagers. I was just having this conversation with a parent the other day. And, rightfully so, her kiddo is dealing with a lot of anxiety and depression. And she's like, I don't know what to do. I worry that she's going to do something serious. And like, I'm looking at putting her on a mood stabilizer. And I obviously always empathize with parents. Like, you don't know. So if you don't be putting your shamey, judgy stuff on parents about medications. And so I go, yep, nope, I absolutely understand that fear. I say, my only concern is if we jump to medication without also incorporating things like meditation and talking to them about sleep and journaling and like just trying, even if it's a yes and, even if it's like, okay, yes, but we're going to start doing therapy. Yes, but we're going to start doing meditations together in the morning. Yes, but we're going to, practice mindfulness journaling and things like that. I say like, high school, yeah, is stressful, but like if the only tool you give them now is medication and you don't teach them any of those other tools, I go like, I worry about her when she's in her 30s. And she's got financial stress, and she's got children's stress, and she's got marital stress, and she's got spirituality stress, and and so the parent was like, oh yeah, that is a really good point. I'm like, so this whole thing is complicated. For real, how did we get on this? Okay, so today's guest is Elizabeth King. She's a certified fertility health coach, a master certified ICF life coach, birth and bereavement doula, and new parent educator. Her mission is to help people of all backgrounds conceive a healthy baby and carry to term. So you're going to hear her story. We talk about how she had 3 children of her own after the age of 40. She loves taking the holistic approach, which obviously works really well because we're a chiropractic podcast. And she loves helping people conceive, as holistically as possible. She's helped hundreds of women achieve their dreams of conception and parenthood in 20 plus countries around the world. She supports clients through natural fertility, infertility, IVF, miscarriage loss, early pregnancy, PTSD, and new parent support. She's got 20,000 followers on Instagram, and she's a host of her own podcast, Pretty Little Tribe. For her expertise, she has been featured on ABC, in Parade Magazine, Thrive Global, Authority Magazine, Business Innovators, and on various podcasts. And The Bachelor to the Burbs is one of the podcasts that she is a contributor, and also a contributor to the book Naturally Conceived. So she's got quite the fun, expansive resume. So let's pray. You know how this works. Let's pray and let's get into it. Dear God, some of the topics on this show are lighthearted and fun, and we have to tether them to purpose. Today's topic can be a major trigger for any women or men who deal with fertility struggles, or miscarriage or PTSD around postpartum. Be with those listening that are first and foremost individually affected by this topic. Just hug their heart as they listen, wipe their tears if they need to cathartically cry, and then go in to start seeing patients for their day. Be with them. For those that are the conduit of your love and the conduit for education, for fertility, help their brain just absorb everything, to not be shut down to anything or advice, and just to receive the information in a way and remember it that they can communicate and continue to guide their patients in the patient's journey. And remember that it is not about chiropractic fixing the person, not about chiropractic solving the person's problem at any point, but we are there to align that person so that brain and body can go on its journey and path at the greatest possible function. So in your name we pray. Amen. All right, crew. So this is Elizabeth King, certified fertility health coach, and I just jamming and talking about fertility. Hope you enjoy. Okay, well, welcome to the show, Elizabeth. It's nice to have you.
Thanks for having me.
So before we really get into, like, today we're talking about so many different things around infertility, fertility. I mean, we're going to cover a lot. But before we start jumping in and I start asking a lot of questions, I didn't warn you. I kind of have a little bit of ADHD. Okay. And so I'm going to do my best not to interrupt you. I really try. But sometimes I just have a burning question that I'm like, wait.
Let it roll. Let it roll.
So you love sharing with people about fertility, infertility. I mean, do they kind of go hand in hand when I'm saying?
Yeah. So I have a funny thing about trying to get everybody to just say fertility rather than infertility, just putting it out there to the universe of like, we are all fertile in some way rather than that. But most people will say they go that direction. That's just my little quirk about things. I like to say fertility.
I love that. So I'm assuming there's kind of a life story that goes with how you've gotten to this point in life. So I would love to hear your background in this.
Sure. So when I was 19, my 26-year-old sister was diagnosed with a lung cancer cell in her cervix, which is extremely rare. There's literally still no.
I already have a question. A lung cancer cell in her cervix?
Yeah.
Okay.
And she actually called to get her birth control renewed, whatever you call it, prescribed, you know what I mean?
Refilled, yeah.
And the doctor was like, we can't do it until you come in to do a checkup, right? Like they weren't going to redo it. I can't think of the word, but anyway, so she went in and it was basically like, there's something there. You need to go right away to go check something. And literally she was in surgery within 3 days.
Wow.
And essentially was given 4 months to live because nobody on the planet had survived this type of cancer before. So it was very like, they had just gotten married 6 months before. Mind you, she's 26. So like their answer was, we're going to have fur babies. We're not, not planning on dogs, basically. I mean, not planning on kids, just kind of leave us alone with that question. And I'll never forget coming home that night of this diagnosis. And she was there with her husband and my parents. And she came up to my room and we just cried and cried because she's like, I never meant that I didn't want to have kids. Like I was like joking about it, like she almost felt like she had put it out there to the universe that this was happening because it was essentially a radical hysterectomy, chemo and radiation. And once you had that chemo and radiation, they told her that she could never have it again in her life because of the amounts that they were giving her. So like if it came back, which they didn't know because nobody had been living from this, like that was it kind of. And so she essentially was like, well, if I have nothing to lose, then let's just go for it. Right. I'm happy to say she's still here today. She's like in the medical journal. It's going to be
a really bummer way to start out the interview.
I know. I'm sorry. That was my first exposure to fertility issues. Like here's somebody so my initial thought in that moment at 19 years old, not knowing anything about anything was, I'll have a baby for you. Like, duh, like that's what I'll do. But at this time, again, now 7 years ago, that wasn't really a thing. Like surrogacy wasn't really a thing. And you had to have all these like prerequisites and mental checks and whatever, which you still do. And there's a reason for that. But essentially that didn't end up working out for us to have that happen for her. But that was my first exposure of like something around fertility where it was not a choice for somebody. And, you kind of always assumed you would have kids and yet now somebody can't. Fast forward to age 30, I got divorced and went to go freeze my eggs and went to the reproductive endocrinologist. And he said, you're too young, come back later. I was like, what does that even mean? Too young?
What?
Like I thought it was
like, no, get them while they're young.
Totally. Well, the thought process around that was basically that, the the embryos thaw better than eggs. So he wanted to give me as much time as possible to have an embryo versus an egg that would be thawing later. And mind you, again, I'm almost 46. That was almost 15 years ago. So the technology has changed drastically. I went back at 36 and the technology of the freezing process had changed. So he said, yeah, let's do that. So I froze eggs. I did a round of IVF. I had 11 eggs frozen at age 36 now. So I had been having a business, my own business since 23, like didn't really think about having kids, but it was almost like checking the box for the 401k and checking the box for the frozen eggs and like, okay, let's move on. Right. Still single and still having fun in my life and whatever. So I felt like it was an insurance policy, but at the same time, he was pretty clear that, you know, there's no guarantees. And I was like, okay, well, 11 sounds like a good number for me to have frozen, you know? And then fast forward to age 39 and a half, I had just met my current husband and my periods had started getting super heavy, painful. I went to my regular OB and they did an ultrasound and said, oh, it's not, there's fibroids, but it's not a problem. I was like, no, I kind of feel like it's a problem. So I went back to that reproductive endocrinologist, the fertility doctor, just to say, I'm hoping that I can use my uterus sometime soon now. Can you just check this out? And he said, yeah, they're small, but where they are, they're in the lining and that's preventing you from essentially the embryo attaching because that's where it needs to go, like in these areas. So he recommended a gynecological oncologist because of the level of technology of what they have to go into the uterus and, or if you're having ovarian cysts or things like that, which I always recommend for people also, rather than going with an OB, you know, God bless them. They have a wonderful position in what they do, but if you are having anything surgical, go to somebody who really specializes in top technology, because the last thing you want is additional scarring or anything as well that could potentially, you're taking one thing out, but then you're causing another issue, right? So here I am now at 40, waiting for my uterus to heal from that surgery. And the doctor was like, okay, well, you're 40 and you got to try now. Like you can't wait any longer. And our first try, we got pregnant. So I was like, oh my God, awesome. Like job done.
Go ahead and throw away those other 10 eggs. I'm fine.
Exactly. So had a fairly uneventful first pregnancy. And then that's kind of when the wheels started turning a little bit as far as my next pregnancy ended in a loss. And it was in that moment where I was having my DNC, which is the surgical procedure to remove the tissue from that miscarriage. And in the bed next to us, like literally 4 feet from us with a drape in between, the couple was doing their first round of IVF. So like I and my husband were at like our lowest low and they were like super excited. And I was genuinely excited for this couple. But at the same time, I realized I had been a life coach since 2008 at this time and realized that this whole up and down of the emotional roller coaster and the level of education that you need to go into these doctors or whatever, nobody's supporting you through that. As amazing as the clinics and the doctors are, when you walk out of the door, like you don't know what to do and you're trying to digest all of this information that nobody really talks about, that as far as fertility and or miscarriage, you know, compared to what it really should be and how often it's happening. And that's when I realized I needed to shift my life coach practice to focus primarily on fertility and miscarriage loss. So here we are. That was 4.5 years ago.
So you have had 2 pregnancies and you have 1 child?
No. So you would think that by where I stopped, but I ended up having 3 under 3. So I have 3 boys. They're 4.5, 3, and 1.5. And then I had a couple more miscarriages in between. So yeah, but I had them from 41 to 44. So that's another big aspect of, I come to the table to say to people, it is possible. I did end up having them all naturally. My 11 eggs did not thaw well. So I was not able to use any of those in the end. And that's something that I talk about quite often because a lot of women in their 30s, especially now with this pandemic, who are not really meeting people as often as they thought they would, are thinking, well, I'll just freeze my eggs. And my information to them is if you get 10 eggs, maybe take 3 and make embryos for them, because I have quite a few actually solo moms that I work with that are in their 40s that are just going through the process now that wish they would have had frozen embryos from their 30s that they could use now.
I have so many questions.
Okay, let's go.
First of all, I always joke with my listeners that I'm a doctor, so I know all the words you just said. But I'm gonna pretend for a second that I have no idea what you mean with between freezing eggs. I get that part.
Okay.
And the difference between freezing embryos.
Okay.
So sperm involved in that?
Yes. Yeah.
Okay.
So essentially the IVF process is they stimulate your body, your follicles in your ovaries to grow faster, bigger, whatever. And then they extract those. Once they extract those, they see, okay, maybe I think I had, as for me as the example, I had 13 extracted. 11 of them were viable to freeze.
Okay.
Had I done embryos, as a single person, I would have purchased
sperm donation. Okay.
Yeah. I would have done sperm donation and had those fertilized. So then I would have had 11 fertilized embryos. So people who are going into IVF as a couple, that's what they do. So they extract the eggs, they fertilize those eggs to become embryos. And then they see from that point, are any of those embryos viable? Are they healthy? And then from that point, people also opt to, sometimes they don't, to have them tested. It's called PGS or PGT tested, which basically is saying, is there any chromosomal issues or any genetic issues with those embryos that are there? So are they essentially as healthy as they can know to be transferred back into the uterus at a later time?
Okay. Thank you. That helps a lot. I was like very confused. I'm like, oh, okay. So you can freeze embryos, which is something I had never even heard of. So you live in California, right?
Mm-hmm.
Yes.
Yes.
Okay. So I live in a very, very small town, but I'm also just in like the middle of the country. And the way that women are treated at one of our local hospitals around fertility and miscarriage is appalling. So basically they don't do any fertility testing until you have had not just one miscarriage, not just two, 3 miscarriages. They will begin to start doing testing. And a lot of times don't really resist doing testing unless you have been struggling with getting pregnant for, I want to say 2 years.
Oh my gosh.
Yeah. It's really, so we don't have a ton of resources around us. A lot of times people have to go to Minneapolis or a bigger city, but even then it's it feels like the woman has to advocate for herself so much. That sounds like a lot of your experience where one doc said one thing and you're like, no,
yeah.
Do you see that a lot?
Not so much where I am, but I do see it a lot because I actually coach women all over the world, literally. And you're not alone in having that. However, fertility clinics are popping up like crazy because the fertility rates are at a 6-year decline globally. And unfortunately, they're going to continue to go that way. So it's something that's not going away, I'm sad to say. But generally, industry standard is if you are under 35 and you've been trying for a year, or you're over 35 and you've been trying for 6 months. My kind of wink, wink, nod, nod on the side to people that I talk to is, you want a baby yesterday if you want a baby, right? So guess what? I've been trying for a year. That's all they need to know.
Yes, exactly. You don't know. You don't have cameras in my room.
Right. And that way I always say, let's get the lay of the land, right? That there's nothing structural happening, that, your cycles, you're ovulating, all of these things, just get a baseline of what you're dealing with, because that's part of, sometimes the hardest part is you don't know what's happening down there. You think everything's fine and you think that it's working and maybe you are.
If you get your period every month.
Yeah.
You're that's the sign that it's working, right?
Yeah. But that's also an indication that within your period, what is that like? Is it heavy? Is it light? Is it longer or shorter? And all of those things can indicate the level of the health of the egg that you have. Then there's a whole other aspect of the partner's sperm. Is he a smoker, a drinker? Does he bike ride? Is he in hot tubs? Does he work with his laptop on his lap? Does he keep his phone in his front pocket? All of these things can, put an issue with the sperm as well. So I always want everybody involved, as if there's more than two people, but both people involved to get checked from the beginning so that they know what they're dealing with. Right. Because then it's a lot easier to work backwards from there, to know what we're working with.
Yeah. So you mentioned kind of casually, we're in a 6-year decline worldwide. So obviously we're seeing fertility become an issue. I mean, Joe Rogan had like some sperm doctor on talking about phthalates. I don't know if you listened to that one. I just know that we switched to all wooden utensils after that episode. But what are some of the leading theories that are out there with, like, are we less fertile? Are we choosing to delay having babies until later in life, and that's shooting us in the foot? Is it the chemical? Like, what are some of the theories out there that are like kind of the leading ones as to what's going on?
I mean, it's a little of everything that you just mentioned. And I think that Dr. Swan is the one that may have been on his, who wrote this book. I think it's called something about counts, or I can't remember off the top of my head.
Right? Like the countdown to zero. Countdown. Yes.
Mm-hmm. And part of that is because of, if you think about our dads or our grandfathers for that matter, like whether they were out working a blue collar job or a white collar job, they finished work at 5 and they came home and they had dinner and they really kind of left work at home. Now we live in a world that is so far from that for men and women, right? So it affects us in both ways. So we're always attached to whatever it is that we're doing. And there's always this additional level of stress that people that went before us didn't have. So that's why when she may talk about these numbers in the 1900s to where we are now, and it's like so dramatic. And part of that, just off the top, is from the level of lifestyle that we have, because we don't have that downtime. We're not sitting around a dinner table at 5:30 at night every night, and like the mom's there making dinner, and like that doesn't happen really very often. So those gender roles as well have changed, because the level of femininity and how we show up as women too, we live in a very masculine way. I know for myself, like I said, I was single from 30 to 40. I did everything for myself. I mean, no offense to my husband, but I didn't really need a man to be there. Like, you have your mortgage, you take out the trash, you pay your bills, you do whatever. And that's living in a very masculine energy way. That affects your hormone levels. Like it just does. It's over time. That's how things change. And then the chemicals in our food, they didn't have that 100 years ago, or even 50 years ago. The hormones in our food. I mean, we are so quick to now say, I'm eating grass-fed beef and all of these like natural organic things. But yet at the same time, most women are on some hormonal birth control pill, right? So there's still a synthetic hormone working in their body all the time. But yet I'm having my organic chai tea or whatever it is, you know what I mean? So it's really understanding from the full perspective of what can I do to shift that kind of worldwide number for my own life, right? So like you said, getting rid of the things in your kitchen that may be causing hormone disruptors, or watching the hot tub for the men and doing all the stress reduction things. And really the mental aspect plays a huge role. There's Harvard Medical School studies that have shown that you're 55% more likely to conceive if you're doing the cognitive work alongside trying to conceive. That's a huge number. That's not 15, that's 55% more likely. And that's why I see so much success with my clients, because we look at it from the mind, body, spirit aspect. We build that fertility team. Is it a chiropractor and an acupuncturist and a personal trainer and a nutritionist, or whatever it is that you need to lift you up and your body up and your fertility up to get to where your end goal is, because we essentially live in a world that's working against us all the time with our fertility. So
one of the things when I have a patient that is frustrated and sad and, in this fertility journey, one of the things that they usually voice to me is most frustrating is some of the stuff that people say to them. It will happen in God's timing. You're just stressing about it too much. So how do you, when you have a new client that starts working with you, I mean, by the time that somebody is like, I am going to pay a coach to get me knocked up.
Yeah.
By the time they're at that point, I doubt they haven't tried much, like I have. So when women come to you or a couple comes to you, how do you balance okay, we need to make sure you're doing this, this, and this, and this, but then the mind aspect of but also like the fact that you're like in this masculine energy, and like checking this list off is part of what's working against you. So how do you work with a client and get that balance?
You're right. Most people who come to me have been down this road for a long time. My ideal client is somebody who's 6 months prior to trying to conceive, because we can get their egg health to a good place. And then hopefully they avoid all that other, years down the road. But dealing with the majority of the people, we do go through a strategy session initially to see what supplements are you taking. Sometimes they're taking too many, like they've Googled online of all the fertility supplements that they're taking, and, their body's having a hard time detoxifying ones that they don't even need. So we go through that based on what their latest blood work may have been from their doctor. And we look at what those are. If I see something that may be a red flag on, let's say, their thyroid, and that's looking too low or too high, I send them back to their doctor to look at that. If their vitamin D is too low or too high, we associate the right amounts for them to get in the right number. Because those are really the first two that I look at for people that are kind of red flags for fertility.
Thyroid and vitamin D.
Yeah.
Interesting.
Yeah.
Low vitamin D correlate or too high? Because you also say too high. Does anybody have too high? You live in California. Some people.
I know. Well, I was on, what was I taking? I was taking 2 5,000 IUs of vitamin D when I was going through my fertility. And that still was like a good level for me, which is pretty high. That's kind of a lot. Yeah. Most people are like 5,000 IU a day. But everybody's body is different, right? And everybody metabolizes it different. So we look at all of those things so that, because people are holding on so tight, right, to like all the things. I'm eating dairy-free, gluten-free, sugar-free. They spent $10,000 on a fertility diet coach and they're still not pregnant. And they're like so stressed about this or that or whatever. And so it's my job to kind of, again, like, let's breathe. Let's take a look at everything. Is it causing you more stress to like do that? If you don't have a food sensitivity to those things, you don't need to avoid those things. That is not going to be the deal breaker for you to get pregnant or not get pregnant. I promise you. So really knowing and trying to do the food sensitivity test and get to know what is causing inflammation in my body, if any. Maybe there's not.
Right.
And working from there. So once we get all of that out of the way, and most people who are on this journey are very type A, and they're very data driven, and they're very intelligent about what's happening with their body. Do you think that's coincidence, or do you think they've been driven into that mind frame? Like you know what I'm saying? Yeah, I think it is a little of both, because again, a lot of those people are they're living in a masculine energy. They're high achievers. They're like used to like, if I'm doing everything, it's going to happen. Like I'm doing all this. Why isn't it happening? I have control. Yeah. And you know what? Fertility is not on our time, right? It's not a matter of like, I'm saying it's going to happen at this time and that's when it happens. Right. And that's part of the frustration is like, you can do all the things and sometimes it's just not that time yet, and that could be because of stress that's going on at work. And people sometimes don't realize like it actually is correlated. And that's where the stress hormones come in, the cortisol, the adrenals, and all of those things. Most people don't realize that they actually are stressed. They think because it's such a normal way of living. Like it's almost like a badge of honor if I'm working like 14 hours a day, but you know what? That's not really healthy if you're trying to have a baby. Right. And especially I often bring into like the spirit realm as well. But like from a spiritual aspect, those spirit babies be like, there's no time for me in that life, right? Like you can't even go take a walk because you're so busy. How are you going to walk me? How are you going to have fun with me if you're not having fun? So we talk about all of these things to let them let go a little bit and realize, okay, how can I still do the things? So my egg health is good and I'm working towards that, but also let go of the things that I don't need to hold on so tight to while still adding in things that help me, tools. So like if I see a pregnancy announcement and I'm triggered by that, what do I do? Because I can do affirmations all day long, but if that's not my jam, that's not going to help me. Or if someone tells me to meditate or journal and I'm not feeling that, then you're wasting your time. Right. So we really work to see for everybody specifically, what is it that grounds you and what is it that gets you to a point where you can get to a calmer state and your cortisol levels are even and your adrenals.
Do you measure do you get cortisol, estrogen, and progesterone tests also in the beginning?
So the estrogen and progesterone are generally done by the RE or an OB on day 2 or day 3 of their cycle. The cortisol levels, generally, this is a generalization, will either be done by an endocrinologist if they believe that that's something that can be measured. Some don't. Some will say it's not really a thing. The urine test doesn't really measure it, and the saliva test doesn't really measure it. In fact, that was one of the doctors that I had. So a naturopathic doctor or maybe a functional practitioner might help. Some chiropractors will be able to run tests like that. I do think that it matters because maybe it's not an exact science of that, but you'll be able to be like, oh no, like I do need to get myself in check. I do need to make more time for myself.
If you are a more if you're a more data driven, that masculine energy person, like somebody coming in and being like, you just need to go for a walk and like this. And then like, it's like, oh, it's too high. Well, how do I get that number down? If that's getting in my way between now and getting pregnant, it's like, you go for the walk. And it's like, oh, okay, fine. I'll go for the walk to lower that.
Yeah. And that's where, especially with women, it's a little bit harder to gauge those numbers. Whereas with the men, with the sperm count, it's way easier. So they can go into a urologist, do a semen analysis, make the changes, take the supplements, go back in 75 days and see the difference of how their sperm is improved. With women, it's not as easy. So that's why I often also incorporate like seed cycling, which is putting different seeds into their diet at different times of their cycle. So day 1 through day 15, it's certain seeds that help promote
flax and pumpkin.
Yeah.
Or is that the second half?
Both. I mean, one's on one and the one's on the other. Okay. But yeah, exactly that. And that helps to regulate because it promotes the estrogen and the progesterone at the different times of the month, which actually helps tremendously with anybody's body, whether you're trying to conceive or you're premenopausal. So we do a lot of things that are natural as well, that they feel like they're still doing something, because sometimes people just feel like they have to be doing something to move the needle. And when you tell somebody that you really just need to let go a little bit, they have a harder time with that. So we work with everybody individually to see what works for them directly.
So you might have kind of already answered the question in what you just said. But like, I'm assuming bringing in the feminine energy is part of what hell is part of this. Cause you talked about how like there's a lot of masculine energy and we need more of the balance of the yin and yang. Then what are some of the suggestions that you give to women on like how to tap into that? Cause I mean, that's something like, I have 2 children. I would not say we had fertility challenges. It took us 7 months.
Awesome.
Yes. It took us 7 months of trying with our second. And there was a very, very early miscarriage in there. But ultimately, when you're looking at I carry a lot of masculine energy. A lot of entrepreneurs just tend to do that. So what are some of like the feminine energy ways that you coach people into bringing it more in?
Yeah. And it's so basic. It's almost like crazy how basic it is, but especially since the pandemic, like we've been home, we're in, like right now I'm in jeans and a sweater, but put on the earrings, put on the lipstick, baseball hats. That's a very masculine like energy, just putting on a baseball hat. So years ago, when I started to do some of this feminine work, I like got rid of all my baseball hats because I'm like, oh, that makes sense, right? I'm showing up as like, this is pretty manly, right? Offering to make food. How can I show up in a way that is tapping into that? It's almost like it sounds crazy because as much as we're like, yeah, girl power and we can do anything.
I know, it's frustrating in my head.
know.
I'm like, you're telling me to get in the kitchen and put lipstick on.
I know. And trust me, I don't cook. So, and it's not even so much like cooking that, it's just like being present there, right? Like, so what can I do to like make it nourishing for my family, right? So am I there? Am I getting the lunch ready for my kids? Am I like doing what traditionally would be, women's things, and, or look at nature, look at anything in nature to know what is the role of the feminine versus the role of the masculine in nature, and just try to emulate that as much as you possibly can, right? A flower, or usually most birds, the feminine ones are the beautiful ones, right? And so there's a reason for that. And, identifying with nature as much as possible in the simplest way. So it doesn't have to be complicated, like put a dress on sometimes, or put a skirt on, which seems so like out of the ordinary for most of us to do that. But it's like, you start to emulate that. It's weird. Like all of my clients will say it is weird, like to sit at my desk at home in a dress, I feel different. Like I just do. I feel different. I feel more feminine, Yeah. And your partner will start to look at you like, oh, that looks good today, And it's just, again, like, it's almost like when you get ready for a presentation or something and you're like, I'm going to put a suit on, or I'm going to whatever, like you stand up a little taller, you feel a little more confident. You're like, yeah, I got this. Right. So it's not that we're leaving that masculine energy behind, because at this point, we don't need to prove it to anybody. Like, we got this. Everybody knows that we do. Like, it's kind of a no brainer, but now it's like going back to the old, like, what can I ask help for? What can I have somebody help me with? Can you open the door for me when I'm going into Starbucks? Can you allow that masculine energy into you a little bit more in a different way?
That's the best advice that I've heard from someone on how to incorporate feminine energy in, because a lot of times it's been with things that aren't natural to me, as far as like, oh, like paint, or like, like make something with your hands. And I'm like, you want me to color? Like, I don't, like, I don't. So like, I can put lipstick and earrings on. Like that's easier, actually.
Yeah.
So let's talk about the boys for a sec. Because we've kind of talked about it a little bit. Like, do you feel like we culturally protect the male from their piece in this?
Traditionally, yes. Now I think they're on blast right now to be like, times have changed, my friend.
Yeah.
Yes. This is, a two-way street. And it's almost ridiculous that this conversation hasn't happened before. Like, of course, I mean, everybody knows it takes an egg and a sperm to make it. So why wouldn't it have been part of the equation before in the conversation? So traditionally, yes, but I think more and more of the clinics are stepping up to say, okay, as soon as we get you checked out, we have the male analyzed as well at the same time, which is great, because when I first started doing this, I had one poor girl who was 3 years into it, only to find out 3 years later that it was the guy's issue. And it's like, that's criminal to me, right? Like, she took on so much stress and so much guilt and so much sadness and frustration and whatever, again, only to find out. And this was not in the States, it was in the UK, but still, it's like, that should never happen, right? We should know from day one. And again, the benefit for the men is, for the most part, it is able to change. You can affect change pretty easily with the sperm.
You can.
Yeah.
Because that lady, the swan, I don't know.
Yeah.
It really seemed like a dire situation where you have the sperm you have. If they're damaged, they're damaged. And there's not,
if it depends. If there's something genetic, then yes, but for the most part, no. I mean, I have clients all the time that are, have low sperm counts and do change lifestyle, diet, supplements, and then again, get tested later, and they're worlds apart from where they were initially. And I love data. So to me, that's the coolest part, when you can actually see like, oh, I did this and that happened, So, but at the same time, most men don't have an awareness. Like they have the myth of like, oh, if you wear tight underwear, this is going to happen or whatever. I mean, there's some truth to that, but at the same time, there's so much more than that. And really that's all that men ever focus on is like that, where, well, no, actually it's your stress level. Are you smoking? Are you drinking? And smoking of any type, because they're like, oh, well, it's not nicotine, it's marijuana, and that's healthy for you. According to some people, it's still restricting the veins in your body. Right. And in doing that, that's causing issues. So, even the supplements like the CoQ10, the vitamin D, the zinc, vitamin C for that matter, like all of those, even basic supplements, it's all comes back to the cell growth, right? And how those cells are forming. And because men are able to reproduce new sperm, whereas women, we're born with the amount of eggs that we have. We do know now that we can affect change in those eggs, which is why I'm such a huge proponent of it is possible to have children later in life. You just need to essentially work on the cell growth of those eggs to just like get them a little healthier, right? Give them some attention, some love, so that they know that they have a job to do, even though they haven't done it until they're 40 years old. It's game time now. So it is possible to do that. And so, yes, to long answer to your question about men, they are getting a little more attention around this, which is great. They need to. I'm a mama of 3 boys. So it's near and dear to my heart to make sure that they're healthy in that way too.
Okay. So you talked about, it is possible to, deliver, have great pregnancies later in life. When did we start calling it a geriatric pregnancy, by the way? What an asshole move.
Totally. I remember the first time they said it to me, they're like, there's a lot of geriatric, the hospital has a lot of geriatric patients. And I was like, okay, good. Good for them. Why are you telling me that? Like, what does that have to do with me? Then I realized like, oh my God, they're referring to me. Like I am the geriatric patient. I'm thinking like the 80-year-olds in the hospital, no. So where I live, there's a lot of older moms here. However, it's 35, which 35
That's
is pretty young.
No,
I know.
No, I remember thinking that like 36 and over. And I'm like, wow.
Yeah.
All right, that seems pretty young.
Yeah.
Okay. So you talked about vitamin D, obviously playing a big part. Does that correlate with the baby blues thing too? Because that's something you like talking about and like kind of prepping for baby once you get pregnant and avoiding baby blues. Because I've seen studies that say like low vitamin D can contribute to that too. But like, what do you talk about with your clients and avoiding baby blues or embracing it is maybe, I don't know.
Yeah, well, it's more of like a heads up, right? Especially if you have gone through fertility, you kind of tend to identify with, I have this issue, right? And then all you ever want in your whole life is to have this baby. And then you have this baby and then you're like, I'm not sleeping. I'm like stressed. I'm having all these issues. And this is not what I thought it was going to be, right? But I'm not allowed to think that it's not easy and fun and beautiful all the time, right? Which I'm here to tell you, no matter how hard you've tried to get your baby, whether it's through adoption or IVF or natural or whatever, being a new mom is hard. So
they just feel guilty of like, I prayed for this. I offered so much that if I could just get pregnant, I would never complain again. And here I am mad that my baby woke up a 3rd time in the middle of the night.
Yes. And it's okay. So I really tee them up for that, to know that all of those things are okay. All of it is allowed. You have permission to have someone help you with your baby, because they also feel like I can't have anybody feed them or wake with them in the night. It has to be me or whatever. It doesn't have to be you. You have to take care of yourself, because not taking care of yourself is going to be even more detrimental later. And I know we all like want to slap somebody when they're like, oh, put your air mask on first and then take care of somebody else. Because when you're in it, you're like, no, I have to do all the things all the time. But your body has gone through so many drastic changes through again, either conceiving naturally and or having hormones to help with that through IVF. And then your natural hormones that kick in through pregnancy and then birth, like it's exhausting for your body. It's very taxing. And then the mental aspect that kicks in with that. And that's why having the right amount of supplements and to support your body through all those things with not sleeping, and you need to make sure that you're eating properly, setting up food beforehand when you have the baby, all the things to like tee yourself up for success, knowing that that's a potential, right? I always say, like, if that means saving your money so you can have a house cleaner once every 2 weeks or once a week so that you don't have to worry about that for the first 5 or 6 weeks, do that. Like, it is so important to make sure that you have the support that you need, that you don't feel like you're doing all the things, you're cooking, you're cleaning, you're taking care of your baby. Because as much as they sleep a lot, there's still a lot to do. You're cleaning bottles, you're changing diapers all the time. Like it's a lot of work and you're exhausted. And that exhaustion, there's a reason that foreign countries use sleep deprivation as a way of torture, because you start to go into psychosis sometimes. Like it is very, very critical for your body to heal and to have sleep. So if that means you take your friend up on coming over to sleep over a few nights a week, do that and don't feel bad about it.
Do you feel like women receive the information? So like, I'm picturing, they're pregnant and you're like giving them this like pep talk of like, here's what you're going to do this first 2 months or 3 months to like, but then they're like, oh, yes, I will. And then they don't really like, or do they actually listen and like follow the advice?
I would say 1 out of 10 does not listen, right? They're super
still
controlling.
Holding on to that masculine energy.
Yeah. Super controlling. I'm going to do everything my way. I'll figure it out on my own. The 9 out of 10 are like, oh my God, yes, I'm going to do all the things. And they are like so confident going into it. They know what to expect with breastfeeding. They have their lactation consultants, on speed dial if they need them. So when those things do come up, they're like, oh, I've heard this before. Elizabeth and I talked about this before. I have the house cleaner set up to come. I have food already ready, either like a food train or HelloFresh or Sunbasket or whatever is coming. I have people on a rotation who's going to be here and when they leave and when they come, and they're like, this is so much easier. And they feel so like the word that they use all the time is I'm just like, I got this. I'm confident. It's, because I had all these things in place and I knew it. And then they're able to enjoy their baby. They don't feel as stressed about being sleep deprived because they knew ahead of time. Because we've all heard, right? Like, oh, get your sleep because your baby's coming. And we don't really do anything of it. But if somebody's like, no, legit, you need to have a plan for this because it's not healthy for you. And as well, making sure that you're taking the postnatal supplements. You don't let go of your supplementation when you have your baby. Because
do you recommend a switch in supplements, or the prenatal and postnatal pretty much the same? Or is there a big
pretty
change?
Much the same unless somebody's not breastfeeding their baby. So essentially we kind of say it's like the 4th trimester, your body is still acting as if it's recovering. It's coming down from this 10 months of building a human, and so we want to still keep those same supplements going for a while.
Okay. So final question, as a provider, and a lot of our listeners are, we're a piece of the puzzle in this woman's journey, right? Yeah. So what are some of the best things we can do / not do if we have a patient who we know is struggling with fertility issues? Like, what are kind of the, make sure you support them this way, don't do that?
Yeah, it's so hard because I feel like you guys are in such a funky position in the fact that they really look for you for so much, right? And your training is really I know how to fix a lot of these things with you, but then
a lot of us are just very focused on the nervous system. And it's like,
yeah. And then when they're crying or whatever, it's like, oh God, what do I do with this? I don't know, and I think part of that is really allowing some extra space and time for those people that are going through this, because oftentimes they don't have somebody that gets it or is there to give them that space to just listen for 2 minutes and know, like, it's okay. We'll get through this. Well, I'll help you figure this out. You can there's a lot of fertility coaches out there. There's clinics that you can talk to. Even if you're in a place where there's not a lot of fertility clinics, I have people from Belgium call a doctor in San Diego who specializes in mini IVF. Like you can do phone consults with people all over the world that can help support your clients or patients to see what's next for them. So they feel like they're making a little progress and that you are part of their team, right? I saw a chiropractor throughout my pregnancy, especially number 2. And that chiropractor was such a big integral part of my journey as far as that, because my body was in pain, and knowing that I had her support through that, and she could then refer me to other people that, could also be in that realm of practitioners that could help support somebody who's going through that. So I think really just opening up your practice to a network of maybe it's acupuncture, like here's a reference for fertility acupuncture that can help, or maybe you should talk to a therapist or a coach that specializes in this, because it will go a long way. And I know some people are not super open to that, but it's almost the way that I explain it to people. It's like a personal trainer. A personal trainer is like a fertility coach because it's a two-way dialogue versus a therapist. Usually they have a boundary of, you don't really know a lot about them. They're listening more to you. And this is a two-way street of, I get you, I hear you, I see you. We're going to get you to the other line, the line that you want to go to. And maybe that's not conceiving yourself, but maybe that's egg donation or embryo adoption or traditional adoption, whatever it may be. But you're not alone in the process and you are supported. So I think just having that space and with those clients that need a little extra attention, like book them in for an extra 5 minutes so you can listen. And I know that sometimes it's hard because we're like, so on to the next person, but at the same time, I think it goes a long way and people will remember that for sure.
Yeah. I think you nailed the role chiropractors play, on the head, because, we just want to fix everything. And so this is kind of, I love your answer because, so many of the times I feel like we're like, I'm not doing enough to get her pregnant. Like it's almost like chiropractors, and I'm sure other professions, OBs, I don't think chiropractic is alone in this, but we view like, I'm going to get you pregnant in a not creepy way. But just being aware that like, there are things called fertility coaches. I didn't know that, I didn't know that fertility clinics are becoming extremely popular, and I could look and I bet you there's one within an hour of my town. And it's our job. Like we see lots of people going through things. This is possibly the woman's first time ever even thinking about this. And so like the idea of a fertility coach may not come to her unless you suggest it or, so.
Yeah. And it's really looked at, as I said, a fertility team. So what are we doing as a team to lift this person up, right? Especially like a collective, as women too, as the collective, what can we do to help support this fellow woman or a human that's going through this, that we can help them on their way, whether that's a recommendation to somebody else or a couple of minutes of extra time with them or whatever it may be. It certainly goes a long way, because nobody ever thinks that this is going to be their life. No. Right. Everybody thinks when I want to have kids, it's going to happen, or I'm trying not to have kids. And
we spend so much trying not to have a baby.
Exactly. And that's the bottom line. I always say it's not a competition of who went through, 20 rounds of IVF or whatever. They all have the underlying feeling of, this is not how I thought it was going to play out. Right. I did not see this coming. So just having somebody to be there to understand and be like, I get it, even if it wasn't your story, I get that this isn't how you thought it was going to be. Let's help you get through this.
Yeah. I love that. Okay. So if people have patients that they want, that they've been struggling for a while and they want to give your information, where can people get more of you?
On my website at elizabethking.com, on Instagram at ElizabethKing_coaching. I also have a podcast, A Pretty Little Tribe, where we talk about fertility and motherhood and all the good things. So yeah, on any and all of those places.
Excellent. Well, thank you so much. I have a feeling your weather today is a lot better than mine. Where in California are you?
Southern California, Orange County.
No, I was born in Orange County.
Were you? Come
Yes,
back.
Mission Viejo. I know. I want to.
My little one goes to preschool in Mission Viejo.
Oh, funny. Actually,
Yeah.
right, instead of winding down the thing, I was born in Mission Viejo Hospital.
Uh-huh.
And then fast forward like 16 years, I'm in La Crosse, Wisconsin on a dance team. And we're like stretching and somebody says something about how I don't get armpit hair. I just never have. And
Random fact.
Just random fact. And somebody goes, "Oh, Sierra doesn't get armpit hair either." And I'm like, crazy. And then I'm like, wait, aren't you from California too? And she's like, yeah. And I'm like, where? She's like, Orange County. And I'm like, where? And she's like, Mission Viejo. And I'm like, shut the No, she was 2 years older than me. But I always say, what the heck was happening in Mission Viejo in 1984 to 86, where us girls don't have armpit hair?
That's hilarious.
Yeah,
I'm going to start asking people around
right?
When and where were you born?
Do you get armpit hair? It's fine. Nice to meet you. My name's Elizabeth. Well, funny. It was a pleasure. Thank you so much for your time. And
thanks for having me. Thanks for opening this conversation around fertility. I think it's so important to build that awareness. So thank you.
Yeah. All right, She Slayers. Until next week. Bye.